Well, Phil, what do you hear from the White House and just folks, again, around the president who are looking at the same things we're talking about? What do you hear from them on that in terms of, look, if there's a flare-up, a further flare-up, I should say, of COVID in the fall, if we get one of those situations where it's spiking in some pretty significant places, I mean, is it something they're expecting? Is it something, what do they say about that?
They definitely realize that a flare-up this fall and into the winter, which is something, by the way, that the CDC director, Robert Redfield, has predicted, and a number of other public health officials have talked about as a very real possibility, that if that were to occur, that could hurt the president politically. But his advisors are looking for ways to change the psychology around the coronavirus pandemic. So understanding that COVID is probably going to be with us for many more months to come, are there things that the White House and the federal government can do to make Americans feel more secure about the virus being out there, to give people hope that a vaccine is coming very soon, even if it may not be coming as soon as the president is proclaiming? Are there other ways to make people feel safer going about their daily routines and therefore less concerned about the pandemic and perhaps more likely to elect Trump to a second term? That's what they're banking on. But the polling we have seen certainly shows that the majority of American people are very concerned about COVID and are not necessarily buying all of the happy talk, at least right now.
Beth, too, when we look at this messaging from the Trump campaign, we think so much about Wisconsin, obviously, is the one we're talking about, but it's those three Midwest states. It's Pennsylvania, Michigan, Wisconsin. Maybe even the Trump campaign, talks about making a move in Minnesota. Very similar demographics, maybe thinking a similar message could give them, make up some ground in all of those states. But again, I look at some of the, and you have some polling up on the screen here. This is from Morning Consult. Look at the one at the top of that list there, Arizona. There's a state that Donald Trump won in 2016, a traditionally Republican state. And the swing voters you're talking about in Arizona demographically are different than the swing voters you're talking about in a Michigan or a Wisconsin or a Minnesota. And it raises the question of the efforts that Trump is making in those Midwest states. If they help him in those states, does that progress potentially come at the expense of a state like Arizona for him?
It does sort of feel that way, doesn't it, Steve? I mean, obviously, he's trying to thread the same exact needle that he threaded in 2016, that very tiny, narrow win that he got in those three states that he flipped, that had been under Democratic, had gone for Democrats for two decades, Michigan, Pennsylvania, and Wisconsin. But you're right, the Sun Belt is changing. Arizona's changing. Georgia's changing. These are states where the suburbs are growing, where educated people are living in those suburbs. They're responding to different kinds of messages. Let's also remember that Arizona has had perhaps one of the worst experiences with COVID of any state. Their governor is a very pro-Trump guy who sort of followed the president's admonition to not take the virus so seriously. They went through a terrible time of this in the summer. There's a lot of elderly people who live in Arizona as well who are very frightened of COVID. So there's a lot of things going on in Arizona demographically that, number one, show the shift from 2016, but also show why Trump's vulnerabilities have grown in a place like that. And it really comes down to his response to COVID.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.